we're going to do some questions. And, well, people, if you have any questions for these two doctors, please scan the QR code in the back of us, and you can submit any questions that we can answer them. But first, let's just kick it off with you. And what's your experience with DEBRIX at this moment? And please take the microphone and...
Okay, our experience with DEBRIX, we used it on a patient who had a chronic wound for almost 6 to 7 years. 6 to 7 years. And in that patient, we finally saw some amount of healthy granulation tissue forming. So with that case, I think I can proceed with more and try it more on further patients. Because initially what we were worried was whether the duration of it being 6 to 7 years, whether it will have any impact. But with this one case, there was impact. So on my side, yes, positive.
For you?
So I'm still a doctor at the orthopedic background. So when you look at predominantly most of my patients have chronic wounds. So the application of DEBRICHEM actually proved to be effective for some of my patients. So mainly the ones with the old standing diabetic foot ulcers and also venous ulcers.
All right. And well, you mentioned your first case was not so successful. Do you have any explanation for why that happened? Now, do you have some experience on the positive side as well?
The possibility may be our first application. I'm not exactly sure whether we applied it, the technique was correct, number one. But the one positive thing that we gained from this patient was from no sensation, he started having sensation. So there was one positive part of it. So I will still take it as a good case.
And, well, if it's you now have the experience with the product, and how do you find the application process itself? Go ahead. Yeah.
So I find it very easy. In fact, it is very direct and it is easy to apply. So the steps involved, it doesn't involve much steps actually. Basically, you just need a single. Basically, it depends on the wound size. You don't need much of the application. Basically, you just need to drop on top of the wound and basically have to lather over the wound and then clean it. And you just continue with your normal routine protocol, your dressing protocol. Well, that's about it.
I imagine it's a bit of the same for you.
Okay, we have an expert at application of DEBRIX. So this is our medical assistant from Shah Alam. So every time so happens we have a patient, he's around. So he does the application. So the technique-wise, the application of the lignocaine prior to application of the DEBRICHEM, applying the DEBRICHEM, timing it. So everything is done, and he does a very good job.
So you're the expert.
Yeah, he's the expert.
Very good. And does that it's the ease of the use of the product? Does it help in the workload?
I think definitely yes, because the case that we had some changes, the one I said that we did have positive change. So initially, what used to happen was we took quite some time to actually debride the wound, but with the application of DEBRIX, so far the time frame taken for us to curette, refreshen the wound has been lessened.
For you?
In terms of workload.
Workload, yes.
I feel it saves a lot of time actually. Basically, when you look at the timing from the employment of the protocol of the application of the DEBRICHEM, I feel like it saves a lot of time actually. So it saves a lot of time, and as time progresses, as the wound heals, I feel it is much more easier and faster.
All right, and so saving time is at some point also saving money for your institutions.
Yes, definitely.
But do you have any insights in how that is for the patient? Does it save also money for the patient?
I think from our side, since we are government, we practice on the government side, so patients don't actually have to pay anything for the usage of DEBRIX. So we purchase it through our budget, and then patient gets free treatment from our side.
And to add on top of it, I feel like we have more reduced follow-up. The frequency has reduced markedly. And when as the wound progresses, it heals. So we tend to lengthen our dressing frequency also. So in a way, it reduces discomfort for the patient also.
So that's basically a good advance for the patients as well. Do you have any other advantages of DEBRIX for the patient that you can see?
I think we are still very new at it, so not much of an experience yet. So I hope to work with more patients using DEBRIX. So advantage-wise, one is getting their consent to use it. So we usually explain the procedure and everything. So I think we'll be getting more patients after this.
Do you see any advantages for the patient other than that they don't have to visit that often?
Basically, it is cost-effective for the patients as well. So you don't need to employ a lot of modern dressing for the patient. As the frequency reduces, you tend to use less materials for dressing as well.
And what about the disadvantages? So the disadvantages of DEBRIX, and how do you handle that?
I guess the first and foremost disadvantage would be in terms of the sensation of pain. So we have some light amount of pain in patients. And then for these patients, usually we will anticipate this pain by applying topical analgesics for these patients.
For you the same?
Yeah, about the same, because disadvantage, I don't think so. But on advantage side, what I would like to add is the amount of duration we take to curate, because sometimes even curating the wound, it causes pain. So that is also lessened for the patient.
And can you put the product a little bit in perspective for me? So a lot of people ask us, how does this compare to hydroperoxide, for example?
Maybe Otto can answer.
Okay, from orthopedic background, so when you look at hydrogen peroxide, so basically it functions as a cleanser. So what it does is actually it lifts off the bacteria and it lifts off the bioburden. Whereas and then it's non-selective. So when it comes to DEBRICHEM, what it does is it only selectively chooses the necrotic tissue and also the slough and also the biofilm. So when it selectively it picks on, it coagulates the protein, it binds with the protein, so it will help healing process at the same time.
On our settings, we rarely use.
So the question is, what?
First 60 seconds. It'll be between 1 to 3, very mild.
That was during the application was 1 to 3.
During the application, yeah.
it develops a necrotic patch over the wound bed, and subsequent visit, it was actually partially detached from the granulation tissue. So every time currently now he comes for his follow-up, we are removing the necrotic patch bit by bit, and what we realize is the underlying tissue now is becoming more healthier. It used to have a bit of difficulty to bleed even when we cure it, but now
worked.
Worked.
What about you? You have any comments on that? How long did you use the product?
It's roughly between 1 to 1.5 minutes.
1.5
It
minutes.
depends on how thick the layer of fibrin is.
Right. And it's sufficient.
Yes.
Yeah. So leaving it on longer doesn't even need to be.
I've never tried longer than 1.5 minutes.
You were mentioning in the case about the thick fibrin layer, and you said we left it on for what it was worth at that point. If you would have that case again, would you again leave it on, or would you try to take it off?
I would rather leave it on, actually. Let the normal healing cascade take place.
Right. Let me see, have a look here. All right. So the list of questions, we covered most of the topics here, so that's very good. And then I want to close off with one question for you both, as in, what would you give these people as a take-home message on the product and your experience with it, and
Make sure all of you get a sample from the booth before you go back. I think it's worth a try. Okay, because this uncle which we tried on, I think it was a chronic wound. So for us to actually see changes in this patient, and for patient to actually see changes finally after 6-7 years, I think it's worth it. So when all methods fail, there's always something out there which we can try. So in this uncle, it was Debridement. So I would say definitely worth a try.
Yes, what Dr. Khalid says, I agree. So we should at least try. I've seen with one case of mine, I'm pretty much very sort of like amazed saying that it works. But there are some cases that is very recalcitrant. At the same time, I feel like it's useful in a sense if we were to apply at the primary care setting, where we don't have much resources to do very extensive sharp debridements and everything. So when we apply this, we hope that we can reduce the need or the use of mechanical or sharp debridement. So it will, and somehow it helps. So those some practitioners who are very apprehensive into employing sharp or mechanical debridement, I feel like you can consider.
All right. Well, thank you very much for these beautiful words, and thank you for joining us in this session, talking about the product. I hope you guys have learned some things today. And if you want to hear more about the product, we're going to have another booth talk at 3:30 here. So with the next coffee break, there would be another interesting story to tell. And for the rest of the day, thank you very much.
Thank you.
And enjoy the rest of the conference.